Daily reports on the coronavirus in Massachusetts are driving a shift from crisis response toward vigilance, with attention toward populations at higher risk. Part of the strategy in Boston is the recent diagnostic and antibody testing done with collaboration from Mass General Hospital. To tell us about the process, results, and possible next steps is the medical director of the Boston Public Health Commission, Dr. Jennifer Lowe. Thank you very much for being with us, Doctor.
Thank you for having me.
Doctor, I guess the one overall impression that a lot of us picked up right away from this test in Boston is that most of us don't have the virus, and that seems to be good news. But I guess there's both good and bad here, right?
That is good news. Based on this study, 10% of our population of the 750 residents that were tested turned up positive for antibody, which suggests that they 10% were previously exposed. That means 90% weren't. I think the good news is that Boston was very effective in practicing preventative measures such as social distancing, staying home especially when you're sick. So I think it's actually a testament to Boston's commitment and resolve to protecting each other in our community from the pandemic.
No, the other testing story is that there has been a lot more of the testing at neighborhood health centers in Boston. What can you tell us about that?
Yeah, so our goal as a city and as a state and country is to increase access to testing. I think one of the issues that's contributed to this pandemic is the lack of availability of testing, and people who thought they might have symptoms being unable to get tested or waiting to get tested, and then consequently spreading the disease. So a combination of just having testing as distributed as widely as possible around the city, as accessible to as many people as possible. And then on top of that, Massachusetts Department of Public Health loosening the criteria for getting testing means that anyone who feels off, and I can go into details more about what off means, but anyone who feels off should get tested. And when they get tested, if they get confirmed that they're positive, they can appropriately isolate themselves from the general public. And that's really how we're going to prevent spread of the disease further.
What do you mean by off? With people feel off, what could that mean exactly?
Yeah, so the symptoms have all along been fever, cough, and difficulty breathing. So those were the cardinal symptoms that people, when they felt those, they would seek attention from their medical provider. So there are some other symptoms that have been added to the criteria. Body aches is quite common, sore throat, an unusual new taste or a decreased taste or smell, which some people have noted, sometimes dissociated with gastrointestinal symptoms, a rash. Those are a little bit less common. But the idea is that we don't have to be feeling really, really ill or having difficulty breathing to get tested. If you have some of those other milder symptoms, you should get tested. And then, of course, we do know that there is asymptomatic spread as well, when someone who does not feel the symptoms also can be a carrier to the virus.
It occurs to me one advantage of testing is that if you feel some symptoms and you go and find out that you have tested positive, you can become a sort of a contact tracer and get other people coming in, right?
That is exactly right. And that is the main point of having testing as accessible to everyone as possible. If you feel sick today, before you even leave your house or go to work, you go straight to the test site, get tested, and within 24 hours, you can know if you're contagious, and you can basically not spread it to anyone else except, hopefully just stay at home at that point in time. So that's really our goal.
I can imagine multiple reasons for testing, at least on a large scale. And one is to get a representative sample of people in Boston, not just to look for the neighborhood that might have the highest infection rates, but get sort of a balance. Why is that important?
So there is a concern that, when you have mild symptoms, it's a pain to go to a provider office and get tested. It's a pain to, if you have kids, if you have a job, etc. So and especially if the symptoms are mild, your incentive to go get tested is also very low. So we want to make sure that people from all walks of life, all neighborhoods, all employment strategies, all ages have access to the testing and really have a very low bar for getting tested, because then we can have a true representative sample and we're not just saying, oh, yep, we know people over the age of 65 get very sick, and we focus on those. It's important to focus our energies on high risk populations like that, but it's equally important to get a broad understanding of our entire city.
Of course, the other reason you do the testing is you want to look at the populations that do have higher rates of infection. We know about that in Boston already. There are racial disparities and things that maybe correlate with human density and housing, but what do you learn from that?
I think one of the ideas is identifying, to your point, what are some possible strategies that we can tailor to address infection rates in certain areas. So you mentioned higher density living situations. Do we need to communicate? You know, some people don't have access to a separate bathroom bedroom. So how can we create education to address the limitations and the barriers that they have from properly isolating? We have a lot of work going towards long-term care facilities. We know that there's a high risk group. What kind of strategies do we need to very specifically implement in a long-term care facility, as opposed to, say, an apartment building with a senior apartment building that doesn't necessarily share all the same space or same staff? So those nuances really help us drill down to the very specific strategies that will be most effective in preventing the spread of the disease.
Well, one thing I'm sure that we've heard already, at least anecdotally, we've talked to people who got tested, found out they had antibodies, they never realized they were sick. So what do you do about people like that? Because there must be more of them out there.
Yeah, so right now we are trying to find out what antibodies mean from an individual level. From a population level, we can say 10% of the people in the neighborhoods in Boston that we tested have been exposed. So that gives us the idea as a city, especially in those neighborhoods as a whole. But from an individual perspective, we just know that they were exposed. We don't know if they have protection from getting the disease in the future. We don't know how long the protection will last. We don't know how good the protection is. So again, all we know is that they were exposed. As research develops, we will learn more about that. And I think people who know what their antibody results can glean some future information about their immunity status, but not right now.
Well, I know that people who follow the news, they see all these positive trends, positive in the sense that they're improving from the state in terms of infections and hospitalizations, the death counts going down, and they hear that most people in Boston are not infected. So they may feel, hey, maybe we can ease up on some of these distancing and face mask requirements. I mean, well, what do you say to people who start thinking like that?
I definitely think this is an opportunity to ease up. But City of Boston has been following metrics in terms of number of cases on a day-to-day basis, number of deaths, and the uses of our hospital beds. So the fact that those are all going down are very reassuring. And so we can be reassured that we can start getting back to a life outside of our homes. But the life outside of our homes does not mean it's the way it was 3 months ago. Wearing face masks is still very important. Maintaining 6 feet of distance is still very important. Those preventative strategies will help prevent the spread of disease. So if I get sick and I'm 6 feet away from everyone who I work with, others won't get the disease. So even though we may be going back to work, we may be going to the store more or a restaurant, the wearing a mask, staying 6 feet away is still imperative to control the reverse, which is to increase numbers again. We really do not want to see another surge.
Well, even if there's not another surge, with more people going back to work, there might be more people worried, even if they have some very slight symptoms. So if they do want to get tested, and maybe paying for that themselves might be an issue, what's the best way for them to follow up in the city of Boston?
bphc.org is our website, bphc.org, and that has a testing a little area where you could go to find a testing site near you. All COVID-19 related tests are covered by your insurance if you have symptoms or if you are a close contact of a known case. If you're asymptomatic and you want to get tested for just because you want to know, that may not be covered. But even if you don't have insurance, if you're, you should not have any issues accessing a test into at those sites that are on our website. And again, if you have the symptoms or if you are a close contact of someone who has been diagnosed with COVID-19, you can get testing.